Hello, my name is Neill Sengupta. I'm an assistant professor in gastroenterology and attending gastroenterologist at the University of Chicago Medical Center. My goal today is to give you some information about gastrointestinal bleeding regarding its evaluation and management and strategies to prevent GI bleeding. So GI bleeding is actually relatively common in the United States. There are certain subpopulations of patients who are at increased risk for GI bleeding. Those include patients who are elderly, patients on medications such as aspirin or Plavix, which are commonly used for patients with heart disease, patients on chronic pain medications such as ibuprofen or other non-steroidal anti-inflammatory drugs. Bleeding is actually a common reason that patients are hospitalized in the United States. Bleeding from the gastrointestinal tract can come from anywhere in the digestive tract, anywhere from the esophagus all the way to the rectum. What we call upper GI bleeding usually refers to bleeding coming from the esophagus, stomach, or the beginning of the small intestine, whereas lower GI bleeding typically emanates from the colon or the very end of the small intestine. GI bleeding is never a normal symptom and always requires evaluation. There are certain signs that predict a severe GI bleed, and those include kind of associated low blood pressure or high pulse rate, associated dizziness or lightheadedness, and passing out at home or vomiting a large amount of blood. Whenever those findings occur, that always requires urgent evaluation in the emergency setting, especially for patients who have significant other medical problems such as liver disease or heart disease. If you are to develop significant GI bleeding, whether it's through vomiting a large amount of blood or passing a large amount of blood in the rectum, that always requires evaluation and urgent presentation to the emergency room. The evaluation at that point typically involves checking your blood counts to make sure that they're stable, checking your other laboratory parameters, and potentially transfusing blood to make sure that your blood comes up to the appropriate level where you're safe. The majority of the time, patients are usually observed or admitted to the hospital, and we perform procedures such as endoscopic procedures in order to, number one, tell where the bleeding source is coming from, and number two, to potentially fix that source of bleeding. For patients who have upper GI bleeding or bleeding coming from the upper digestive tract, we typically perform a procedure called an upper endoscopy, which is where we take a camera and after you're sedated, we go in through your mouth into the stomach and the beginning of the small intestine. And that serves to, again, localize sources of bleeding, such as ulcers, and potentially fixing the active bleeding at that point. Management usually involves also treating you with medications such as proton pump inhibitors, which includes omeprazole or Nexium, and those have been shown to decrease the rates of rebleeding in the future. For patients who have a lot of red blood coming from their rectum or symptoms consistent with the lower GI bleed, management again involves stabilization in the hospital, transfusion of blood products as necessary, and usually we perform a procedure called a colonoscopy. The colonoscopy involves drinking some laxative fluid the night before in order to flush the stool out of your system, and then performing a procedure where we take a flexible scope and go in through your colon and evaluate any sources of bleeding. Again, we can potentially localize the source of bleeding and fix it at that time in order to decrease the rate of bleeding in the future. After hospitalization, there are a variety of things that can be done by patients in order to decrease the risk of future rebleeding. That involves appropriate management of anticoagulant and antiplatelet medications, and also for patients who have risk factors for upper digestive bleeding to ensure that proton pump inhibitors are taken and to avoid non-steroidal anti-inflammatory drugs such as ibuprofen whenever possible.